Okay, so this is our intro slide. We're just going to do a general overview of long-term care processes, kind of geared towards um, staff in the hospitals. As a reminder, anytime you have a question or want to submit something related to Medicaid long-term care, PASSR, or swing bed, you can send in your question to this DSM address, DSDS LTC authorizations. It's monitored Monday through Friday by our team during normal business hours. That's probably the quickest way to get a response versus calling, and we'll try our best to answer any questions you have. As a reminder, anything you send in direct secure messaging has to come from a direct secure messaging email address. So you can't send it from standard Outlook. It has to be DSM to DSM. So that's our main address for questions and submissions. Moving on to the next slide here. This is just again, DSM. If you have a new staff member or you want to get access to DSM, direct secure messaging is overseen by Health eConnect Alaska. They have a website. You can Google Health eConnect Alaska. There's a process to set up a login, and you'll work with your facility supervisor to get access. Once you get access, this is kind of just a screenshot of what the inbox looks like. It looks pretty similar to a regular email, but it's secure, so you can send health information and records and things like that. So that's DSM. Again, make sure you submit it to this main inbox. That's the one that's constantly monitored by our team. Um, Anything you submit should always be sent there. To start off with, I'm going to go into PASSR. PASSR stands for Pre-Admission Screening and Resident Review. It's a federally required process for anybody who's admitting to a long-term care facility that accepts Medicaid or Medicare. The purpose of the PASSR, which is a form and a screening, is to see if someone who's going into an institution, a long-term care facility, has a mental illness, an intellectual disability, or a related condition. Scott, do you have anything that you want to add on that?
Not at the moment. I think that is a good broad coverage of what the PASSR is.
This is just going to be a general intro and overview on PASSR, but when you fill out the form, what we're looking for is, does the person have one of these needs? If they do have one of these needs, it's not going to be a negative screening. It's going to screen positive, and it's going to move to a level 2 evaluation process. Um, on this next slide here, it's a little bit of info about PASSR. I'll talk a little bit more about that in a second. So this is just kind of overview of the PASSR process. You're filling out the PASSR before LTC admission. You're sending it to us via DSM. On our end, we're gonna do a review of the form that you filled out and the records and see if the person needs a level 2 evaluation. The level 2 evaluation is looking for, is this person gonna get specialized services in an institution for an intellectual disability, a related condition, or mental health needs. That's done on the back end. Once that's completed, we send a copy of the final PASSR with the determination and the level 2 evaluation report to the facility, whether it be the hospital if the person's still waiting to admit, or the long-term care facility. Um, that's just kind of a general overview of what PASSR is, and it's a 4-page form that's filled out for anybody going to a long-term care facility, regardless of their payment source. PASSR is kind of its own beast as far as learning about all the ins and outs of it, but generally, we're always looking for anybody, if they have a mental illness, intellectual disability, or related condition, and they're moving into a long-term care facility, we really want to catch that at the time of admission. PASSR, I know I'm moving around a little bit here. PASSR has a technical assistance center. And there's a website linked here. On this slide, this is just their website. It's called PTAC, PASSR Technical Assistance Center. They have webinars that are recorded if you want to learn more about the ins and outs of PASSR. They also have, I believe it's a monthly training called PASSR 101, and it's kind of just an intro specifically geared towards PASSR. The next one that they're doing is July 24th, and you can go onto their website and sign up for that webinar if you want to learn more about PASSR processes. It's generally a good intro for somebody who's just stepping into the role of completing PASSRs and wants to know about the form and kind of maybe a little bit about the history, why it's required, things like that. But they also, all their recorded webinars go into great detail about um, some of the intricacies of PASSR, so the level two evaluation piece, maybe some of the other determinations besides just a negative screening and a level two evaluation. So that's a really great resource, and we encourage people to take a look at their website. It's through CMS, and definitely learn a lot about PASSR through PTAC. And then, Scott, did you want to add anything before we move forward?
I guess just a quick note on the level two evaluations. This is generally an in-person assessment of the individual from a clinician. So if we refer them, it'll go to either IDD or DBH to evaluate any kind of special needs they would require that would not otherwise be provided at a long-term care facility. So just, a general description of that.
Okay. This is just an example of a filled out PASSR form. The form is on the state website, and I'm sure you guys have a copy. It's completed anytime somebody goes to a long-term care facility. Uh, this example is also in some of the resource material that was sent your way with this meeting invitation. I did want to touch on a couple common mistakes or concerns that cause delay in getting a PASSR processed. The biggest one is just making sure all the fields are filled out on the form. Every section needs information. So make sure there's the full name, date of birth. If the person has Medicaid, it's listed there, an address. The representative's really important because if this person's going to admit to a long-term care facility and they don't have cognitive capacity, a representative needs to be listed here showing making, who's consenting to admission and making medical choices for that person. The current location, which in this case for your staff is going to be PAMC and the admitting facility or potential admitting facility. The date. Then we move forward to the second page. On the second page, you're going to list any of those possible PASSR concerns. So, like I said, it's going to be a mental illness, an intellectual disability, or a related condition. That's what we're looking for with the PASSR. In this example, the person has depression and anxiety under mental illness. They have a mild intellectual disability, and they also have a related condition, a TBI in childhood. Um, Related condition isn't a common thing that people will put is the person had a stroke, so they'll put that as a related condition. Per federal regulations, a related condition is something that's diagnosed before the age of 22 that could manifest similarly to an intellectual disability. So typically, it's going to be something like an injury in childhood, like a TBI, or it could be a genetic disorder like Down syndrome or cerebral palsy. While those conditions don't always manifest in an intellectual disability, they have the potential to. So it's considered a related condition. The person will likely not screen negative. They'll at some point be referred for a level two evaluation, and the evaluator who specializes in intellectual disability and developmental needs will make the determination on if they need specialized services for that related condition. But those are the three things we're looking for. All these these four boxes with questions have to be filled out, and it has to have a physician signature. Per regulation, we can accept nurse practitioner or physician's assistants. It has to be an MD or a DO. That's another common reason that these get returned. It has to have a physician signature. Um, and then there's some boxes you can fill out as in regards to if the person's having specific needs or behaviors. But the form also has to be signed by the person filling it out. Sometimes this gets missed, so make sure you put your name and sign it at the end. And then with all PASSRs, we at least need an H&P or a recent progress note that shows the client's current needs or health diagnoses. We can't make a PASSR determination and we can't complete the screening unless we have recent records that show the person's needs. So that's kind of an overview of filling out the form. Scott, did you want to add anything before we move forward?
Not at the moment.
Okay. Oh, last thing, this is the page that you're going to get back. So after you submit the form via DSM, this is the page that the state RN will fill out. It should have all these red fields filled out, and it'll have a determination on it. For this one, it was a negative screening, just as an example. But as we reviewed the form, the person had mental illness and intellectual disability, so it certainly would have been referred for a level 2 evaluation, and that would be under here. But this is the form that gets signed by the state nurse, so you know it's complete, and it'll have a determination on there. Next, I'm going to talk a little bit about long-term care authorizations. This is a second form that's filled out. Long-term care so PASSR is for anybody going to a long-term care facility. The authorization form is only for clients that have Medicaid as a payment source. So that's geared towards this is going to be geared towards just Medicaid clients. It's a separate form, it's 6 pages. This is used for Medicaid to pay for the person's stay in long-term care or in a swing bed placement. Generally, this form's filled out and you include any recent records that support level of care, and you also send it via DSM. Both the PASSR and the authorization form are required for clients that are going to a long-term care facility if they have Medicaid. If the client has Medicaid, but they're going to a swing bed facility, they only need the authorization form. So PASSRs aren't required for swing bed admission. Just the authorization form. So these are just some examples of the records that we're looking for when you're submitting an authorization request for a client with Medicaid. And I'm going to touch a little bit about nursing facility level of care. So when you send in an authorization form with the records, the state RN is reviewing the form and the records to make sure that they meet the client meets the criteria to admit to a long-term care facility. And this is kind of a very boiled down overview of what the different levels of care are. For skilled, if they're going for skilled level of care, they're generally getting some type of skilled service 5 or more times per week. So that could be therapies, it could be wound care, it could be some type of infusion like IV antibiotics. So a nurse or licensed personnel like a physical therapist, PT, OT, ST is giving a skilled service 5 or more times per week for skilled level of care. The maximum we can authorize is 3 months. If the person doesn't have skilled needs, but you're still trying to help them get into a long-term care facility, you're going to ask for intermediate level of care. So the person's going to have less than 5 skilled services per week. The maximum auth period is 6 months. The main difference between these two, besides the frequencies and the maximum authorized period, is that with skilled, they're qualifying for placement based on those skilled needs. For intermediate level of care, ICF, they're qualifying mostly based on how much support they need with activities of daily living. So a lot of people that are going into a facility at ICF level of care need a substantial amount of assistance with things like getting around in bed, getting in and out of bed or in and out of a chair, getting around in their wheelchair, going to the bathroom. There's somebody that's providing a substantial amount of assistance with those ADLs in order for them to meet level of care. So all of this really should be illustrated in the records you provide. The records can include the skilled services, or they can also include CNA and nursing charting showing, hey, the CNA is helping this person use a lift and get up to a bedside commode twice a day for toileting, things like that. But we're really looking when we're making a determination at the records to support authorizing the level of care. Scott, did you want to add anything to that?
Um, yeah, I guess just to add a little bit more to the ICF, like someone who would probably qualify for that, you would look at someone who would rapidly decline outside of facility if they weren't getting pretty extensive assistance with a large selection of their ADLs.
Okay, and we'll go ahead and move to the next slide. Administrative wait days. I know this isn't applicable necessarily to everybody, but administrative wait days are kind of like an add-on service to an authorization. So if a person is authorized to go to a long-term care facility, but there's a delay in getting them an open bed and they're hanging around at the hospital waiting to discharge, the hospital can ask for administrative wait days, and it allows reimbursement for some of those days while the client waits for an open long-term care bed. If you're asking for administrative wait days on an authorization, it's really important that you check the AWD box in addition to wherever they're placing. So they're going to place in long-term care or swing bed, but Providence is waiting for an open bed, so you would also check this AWD box. And then also underneath their current location other, very important to put PMC's AWD facility ID here because that's used for billing. Um, some of the times that gets missed. It seems like there are certain staff that deal more with AWD than others. So I won't elaborate on this too much other than if you're looking for administrative wait days while the person's waiting for an open bed, just make sure you also check that box and put your facility ID under the other so that when the person does actually admit to long-term care, they'll on our end we'll be able to process stuff so we can provide the reimbursement for the AWD days. Um, yeah. Scott, do you have anything you want to add on AWD?
Um, Not at the moment. I think maybe just that um, pass hour or a pass hour would still be required with the AWD submission, just because the intention is to send them to long-term care. So part of our process would be to just have that in place beforehand.
Yeah, good point. So if you're still waiting for an open bed and you're still looking to place the person, um, and you want that AWD coverage, it's going to be added on to an authorization for long-term care placement, and typically those are going to come with a PASS-R because it's potential placement in long-term care. Uh, all right, so we'll move to the next one here. Just wanted to go a little bit over swing bed. Swing bed's pretty similar to placing in long-term care. Really, the only difference is that authorizations for swing bed, you don't need a PASS-R. Because a swing bed is a bed in a acute care hospital that's designated as rural access. So they swing their acute care bed in a rural facility and make it a long-term care bed. Because the bed's technically in an acute care hospital, we don't have to go through the PASS-R process because it's not really a long-term care facility. It's a swing bed in an acute care hospital. So just the authorization form is needed for swing bed. It's a separate placement category. So the box checked is always going to be swing bed. And same thing as far as like records go and level of care on this authorization. we're looking for records to support a certain level of care and to support placement. Um, so that's the main difference, just that swing beds are in a rural access hospital because they're an acute care hospital. It doesn't require the PASSR. And then this, I just wanted to quickly go over the authorization form. This is 6 pages, and there in the reference material again, there's an example filled out. Um, One of the most common reasons for delay in getting these signed off on the state's end is that the form is incomplete, so all the fields should be filled out. Very important that you get the person's name, date of birth, and Medicaid ID correct on the form. That you're asking for some period of coverage. You can put it on here at the first page. On the our signature page, when the state RN reviews it, we'll make any adjustments if needed based on what's outlined in the medical records. Um, Placement category is going to be LTC or swing bed. You can also check the AWD box if you're asking for administrative wait days, but please don't check all three of these. It's going to be you're placing the person in long-term care, you're placing them or you're placing them in a swing bed, and you can ask for AWD. So it could be LTC with AWD or swing bed with AWD, but not all three. And then moving to the second page of this, you put a potential facility, any alternates can be listed. So if you're pursuing a couple different facilities and you're waiting to see who has an open bed, you can list the alternates there. You can put the person's representative if they have a decision maker who's helping them consent to placement. This chunk in the middle is for travel. So let's say the person's at Providence and they're going to admit to a facility in Fairbanks and they're going to need to fly to Fairbanks. The receiving long-term care facility staff need to sign this section in order for travel to be processed with the authorization. So sometimes we'll send it back and say, hey, we need a travel signature. Please have Denali Center in Fairbanks sign this travel section. So very important if you're requesting travel to have that. The discharge planning is another area that's sometimes missed. It's a requirement per CMS to have person-centered discharge planning in place. So this section does have to be completed for every authorization request. And we're looking at that and seeing what's this person's plan, after they leave the hospital. And permanent placement in a long-term care facility generally isn't accepted as a plan for discharge. So most of the time it's going to be maybe they're doing some therapies in long-term care, and then after they complete their therapies, they'll discharge home. Or they're gonna get IV antibiotics for 4 weeks, and after they complete that course, they'll discharge to an assisted living home, something along those lines. But we're looking at that for what the person's plan is after they leave PAMC. On this next page, it doesn't have the PASSR form has to be signed by a doctor per regulation. The authorization form doesn't. Sometimes facilities will choose to have their doctor sign the form. It doesn't have to be. But if there should be something in the records to support that you're pursuing placement in long-term care if there's no signature or order for placement. And then another thing, there's a section for medications here. A lot of times people are on a lot of different medications, so what you can do is just put C attached and you can attach a MAR or you can attach a provider progress note with a medication list. Just ask that if you don't fill out the medications, make sure you send in some records that have a current medication list because we're looking at that as well when we're making a level of care determination. This next section for the ADLs, pretty important that all of these boxes have scores in them. We're looking at these scores to again determine level of care, and we're also looking to see if the scoring matches the information that's outlined in the medical records. And then cognition section, if the person doesn't have decisional capacity, please indicate that, or if they have cognitive problems, please indicate that here. Typically, if they have cognition concerns that are significant, they're gonna need a representative on the form. And so if someone's just had a stroke and they have altered mental status and they're not oriented, that representative doesn't have to be a guardian. It could be the person's spouse, and that'll be their designee per Alaska state law until the person can get an official surrogate decision maker, power of attorney, or maybe they'll be pursuing a guardian. But you can, if the person has cognition concerns, please remember if you're checking problems here, they're probably also going to need a representative on the forms. Therapy services, you can just list any skilled services the person's getting. There's some examples here. And then you can check any records that you're including with the submission. Did you want to add anything, Scott, before I get to the signature page?
I guess just a quick note on the ADLs at the top of this page. If this client didn't have any skilled services, such as wound care, which is listed here, we would question why long-term care placement is being recommended. So that's just a time when we might call or message you to provide some clarification as to what this individual's needs are for long-term care.
Okay. And then the last page of the, oh, and sorry, the last page that you're going to fill out at Providence is just your name and that you're filling out the form. Make sure that you sign it. The final page of the document, so page 6, is the one that's filled out by the state. This will have the level of care that we approve and a date range, and then that it'll be signed. So that's how you know that it's been approved and is complete. And I believe that's all I have for the slideshow. So I'm gonna go ahead and stop the recording because that was just the general intro, and then you guys can ask any specific questions. That way we don't include any health information or PHI in the Q&A. So let me go ahead and stop the recording.